Hey, Kidney Warriors. I need some help from you.
This is a weird case. This patient got a CVC in October of last year, and then she got a PDC, which is a PD catheter, the next day, which is not abnormal. She's going to do hemodialysis until her PD exit site heals, which takes 10 days to 14 days. So she gets this in October, and she doesn't meet her PD nurse until December. That's 2 months. Her site's all healed up a long time ago. When she sees her PD nurse, they start training, but the PD nurse realizes that she's not draining properly. And the PD nurse also gets sick, so she stops training with the PD nurse. Now, I'm not sure if this lady left some stuff out, but she jumped to February, to this month, and said, the PD nurse got sick, so next thing you know, in February, I am seeing the PD nurse. I'm still not draining, so they send me to the surgeon to move the catheter to a different spot. So, surgery for the PD catheter in October, meets the nurse in December. Nurse gets sick and she can't drain. In February, they send her to a surgeon. So, when they sent her to the surgeon moved the catheter to a different spot. And last week, she went back to the PD nurse and it wasn't draining still. So, she met with the nephrologist, and the nephrologist said, go to the ER. And at the ER, they're going to give you cath flow. So she goes to the ER, they put cath flow in her catheter, and she waits a few hours and it still wouldn't drain. And then the nephrologist said, oh, it's still not draining? Well, we got to move your catheter again. You need another surgery. This just sounds weird to me. I'm not sure if she's leaving a lot of things out, but normally you have your PD surgery where you have your catheter. That within that week, the nurse is calling you. Hey, my name's Nick. I'm your PD nurse. I see you got your surgery yesterday. How'd everything go? Can we meet within a week so I can change your dressing? The PD nurse changes the dressing and flushes it to see if it's working. The next week, we were meeting again. I'm going to flush your catheter again, maybe change your dressing again, see if everything's working fine. If it is, we should start training because 10 to 14 days has elapsed and you should be healed. And then you start training. Now, if you were having draining issues, I would first question is, are you constipated? Because if you're constipated, that can block the catheter from draining. I would have you move to different positions, see if that helps. I would ask you if you had any kind of previous abdominal surgeries. Did you have a C-section, gastric bypass? That can leave scar tissue. And if that were the case, then you shouldn't have been doing PD in the first place if you have scar tissue buildup that's severe. If you're not constipated, no scar tissue, I will call a doc. Hey doc,